We are checking in on how the district is handling the return to learn after the holiday break. Columbia Public Schools Superintendent Dr. Peter Stiepelman joins us live this morning. Thank you so much for being on with us.
Good morning.
As we just said, in-person classes are set to resume at all levels on January 19th. Considering the state of the pandemic right now, do you feel that's possible?
Yeah, and so as you mentioned, the board in November decided that they would be bringing back students or having students return at the beginning of the second semester, so that's January 19th. Tonight I will share a number of the items that you just mentioned. We'll be sharing case rates, positivity rates. We'll be looking at mitigation strategies. We'll be looking at those districts that we compare ourselves to. We'll be looking at recent findings on the efficiency or the efficacy of masks. The CDC has run a number of studies recently. We'll also look at what the Illinois Department of Public Health has said about transmission in schools. So we'll be providing the Board of Education a lot of information for them to make the most informed decision. I know that they've been incredibly engaged, and as you might expect, they've been getting a lot of input from our community over the last few days.
And what has some of that input been from families and teachers and even Board of Education members themselves? What have you heard in general?
Right. So in having just some conversations with them over the weekend and just kind of hearing what their thoughts are, it's really important that they don't talk about how they're going to vote, but just wanting to kind of think through or ask questions. That's the important piece because their discussions really need to be done in the public. And so what they're hearing from the public is, as you might expect, there is a large group of our community that feel that we have been in a virtual learning realm for 10 months now. And that they believe very strongly that it's time to return. And as you might expect, we're also hearing from a very large group of our community that feel that the vaccine is just around the corner and that it would be more appropriate to wait just a little bit longer before that. And so, boy, I don't get a vote, and so really I provide the information, and it is going to be a very difficult vote, no doubt, for our Board of Education members. They are so engaged, they love this community, and they just want to keep everyone safe. And they also recognize every bit of why it's important to have children back in school. And so we all want our kids back, and we're all trying to figure out the best way to do that.
With the in-person return currently set for January 19th, we are monitoring that 14-day case rate in the district. Now, it's currently nearly 30 above the number that suggests virtual learning. Would it make sense to return with that rate so high?
Yeah, I'm glad that you're pointing out we have a 14-day tracker. In August, the Board of Education adopted a number of tools, and one is a 14-day tracker that we keep on our website. And you're right, it has gone up considerably since in October we returned when it was about 30, and at this point it's almost 80. It is one of the factors that the board uses in terms of looking at our data. We saw an uptick on Friday because on Christmas Day there were only 3 positive cases listed, so we saw an uptick, and then we'll see another one later this week because on New Year's Day there were only 4 positive cases, so we'll probably see another increase. So it is something that the board considers as I bring them information. The 14-day rate is certainly something that they're paying attention to.
And if the board chooses to return to in-person learning, will CPS be utilizing the new quarantine rules as suggested by the state?
So the local health department didn't adopt those rules, and so we won't be using them. We did give an update last month that indicated that if we were in a virtual environment, that an individual who was not displaying any symptoms, who had been quarantining, could return on day 11 as long as they could physically or socially distance from others when they were eating, as well as not have any contact. But I will tell you that one of the things that is really been clear by board members is to make it incredibly clear that if we do return, because of these studies coming out of Mississippi, the study that was done just now in Missouri that we'll get the results in about a week or so, that masks work. And so we will make it really clear that masks are required. And so, we initially started with encouraged, and then we said they're expected. We want to make it really clear that the CDC, the study out of Mississippi that says that transmission is incredibly low when everyone is appropriately wearing their mask. And so we'll insist that people have to wear their masks at school.
And now we've already seen state legislation in this new session filed about schools and the pandemic. One of them, Senate Bill 346, requires in-person learning for districts to get CARES Act funding. Another from Representative Chuck Basie would make school districts provide an education voucher if they don't offer an in-person learning option. What is your response to these proposals?
Yeah, it is. It's somewhat dismaying because when you look at the decisions that a locally elected board in a state that prioritizes local control, the board made really smooth, important decisions that were based on data and based on the advice from the public health department, based on the advice from virologists and epidemiologists and infectious disease specialists. So these weren't just sort of out of the blue decisions, but rather really thoughtful decisions that the board made. And so the thought of retroactively, the Senate bill that you just mentioned says that they would retroactively remove funding from schools, whereas meanwhile, the school district has spent an incredible amount of money to make sure that virtual learning was successful. So whether it be hotspots or technology or making sure that food is being delivered to students, making sure the mental health services are being provided, all of those, we use those CARES monies for that. So it's somewhat dismaying, particularly when you think about you have roads and bridges that are crumbling. You have that internet should be a utility that everybody gets, that there should be an internet sales tax to make up for the $400 million of revenue that they're expecting there to be a shortfall. That's where our attention should be as Missourians, rather than going after public education at a time where we should be really raising up and celebrating the incredible acts of our teachers and our principals and all of those making virtual learning as best as it can possibly be in a global pandemic. So you can see I get pretty excited about it, but it's an important piece. We shouldn't be. I'll just stop there.
Some staff in the district have actually already been vaccinated. Can you take us through the groups eligible for the vaccines right now and what that process has looked like so far?
Sure. As the community probably knows, that there are different tiers in terms of vaccine rollout. And so right now, as a state, we're in tier 1A, which is mostly those who are working in hospitals or dialysis centers, cancer centers, those types of things. And so we have a partner in Boone Hospital. They have been our provider for flu shots, and then they will also be our provider when it comes to the COVID vaccine. And they were incredibly thoughtful about considering our nurses and our nurse secretaries who are face-to-face with students, particularly also our special education teachers who are face-to-face with medically fragile children. And so 216 of our employees, remember we have about 3,000, so 216 is not that many, but it is certainly a great start. And so they were vaccinated this past weekend. So I think it was the 9th that began. And so what we're doing right now is tonight the board will consider a resolution to speak about the importance of the vaccine because we see it as a game changer. That's not to say that we wouldn't return without a vaccine, but just to recognize the importance of vaccinating school employees. That's bus drivers, that's custodians, that's homeschool communicators, that's teachers, that's anybody who's working in a school environment. And so that will be tonight as well, because 1B is just around the corner. And then as a group, we'll be working with prioritizing. So that way, should the health department tell us that there are now 1,000 vaccines that are available for Columbia Public Schools, that we then have a tiered system of our own in terms of like a decision tree to say, okay, who are our employees who are at risk, have an underlying health condition? We'll start there and those types of things. So that's where we are right now with the vaccine. We're really excited. It's just around the corner, and that to us is very promising.
And of the staff eligible to get vaccines right now, how many have opted in? Is there general interest in getting those vaccinations?
Yeah, thanks for the question. That's a really good one because we did survey our staff right before the holidays and then throughout the holidays, and then we continue to. So right now we have about 2,000 who said they want it and about 200 that have said no thank you. And so and then the others have not yet responded, so we'll be pushing out another reminder to let us know. But that's really promising in terms of the percentages of those who are interested in having the vaccine. One of our concerns certainly around the nation and then here locally has been whether or not people would trust the vaccine as being reliable. And what's really nice is that they do here. And that it is working. When you have a vaccine that's 95% effective, that is huge. And then even with the new strand or strain that is seems to be manifesting in Europe, B117, that's a real concern for us. And yet to see that that vaccine seems to be working against that as well, also it just increases our enthusiasm for being able to return to normal at some point soon.
And when do you expect the entire staff to have access to the vaccine?
Yeah, so it is our hope, well, it was our hope that it would be mid-January, but a big part of this relies on the state. And so that resolution is also to serve as encouragement to get that vaccine out to us. We've heard from the incoming Biden administration that they intend to release more of the vaccine to the states. And so that's also encouraging, because if 1B can be done and then we can move on to the general public later on in the summer, that's great. But what we're really excited about is that 1A is coming to a close and that 1B is right here. So I would guess in the next 2 or 3 weeks, we would start to see those clinics starting. And Boone Hospital is so wonderful that because of the fact that the vaccine has to be held at a certain temperature so that we can do it at their location, and then their doctors and nurses are available to answer questions or address concerns.
Yeah, that is great to hear. Unfortunately, that's all the time we have this morning. Thank
I
you
understand.
so much for being on with us, Dr.
You're welcome.
Stiebelman.
Thank you.
Thanks.
Take care.